Is my hear clear?
Yes, we can hear you.
Yeah, it's okay. Thank you, the President Posler, to give me invitation. And I'm happy to join this conference to discuss about the women's health in the international professional group. Thank you, Dr. Agawad, to talking about PCO. It's a topic I'm interested in the clinic. But today, I talking another topic about the how TCM to promote the assisted reproductive technology. Anyone know ART, assisted reproductive technology, is this century's medical revolution. They created by the profession Arthur Robert in our UK to have the Nobel Award. This is where since about 20 years, I do practitioner of traditional Chinese medicine, also involved to promote to ART. We know the ART, we have the first the Nobel Award in the 2010, but actually we start in the UK to do ART. It's before that. So this is where we around about 20 years to get promote to the ART. So this is where my surprise, our experience, how using the TCM in the right way, and how prove our work to give the ART support. So this is why my artery to publish in the medical acupuncture in 2019. And we also be involved the book, the further of the ART. We have the TCM preparation to conceive and promote to ART as one chapter in this book. They should be published soon. We know at the beginning, the ART, although this is a revolution, medical technology, it's popular to using in medical fertility clinic in UK and throughout the whole world. But at the beginning, the successful rate has been higher. Our near hospital is always about 20 to 30% the successful rate. This is where making a lot of ladies is worried about. And the most of the fertility treatment to ART is always private. Patients have to pay by themselves. So this is where if pay a lot of money but hasn't successful higher enough, this is where a lot of patients come to see us for alternative treatment if give any promotion. So definitely we have done something good. From the report, we notice they always said acupuncture can do something for ART. Chinese herb can do something for ART. Nutritionists always say the diet and nutrition balance well also can be promote ART. Exercise, psychological also can be help. But my experience, always acupuncture, nutrition, everything, they treating figures not enough. The treating level is too lower, not good enough. So this is where we recognize only a whole system of traditional Chinese medicine can be patients have preparation with a higher enough the treating level. Then we can give successful to support to ART. I gave you, today in here, I gave you some details where I say TCM, the whole system, is able to give the ART help enough. So we said ART have the 5 common kind of technology: IUI, IVF, IVM, ICSS, and so on. A research from American doctors, they're using the 1,231 fresh case to do the research. During them, they classify the patients for the 3 groups. One group is normal IVF. The second group, they gave the patients is acupuncture only the day pick the egg up and the day the fertilized egg fit in. And the third group, they gave the patients 3 months traditional Chinese medicine, fully support, then go into IVF. Then we can notice for the patients using an egg to do IVF, the normal the group is 48% result successful. That means the childbirth. The acupuncture only, the successful rate is about the 51%, but the whole TCM preparation, the successful rate can be getting 61%. Another group, the patients we gave the donated egg. We always notice the patients, if they waste the TCM preparation, if going IVF with the egg donated, the successful rate can be reached 85% and more. So why whole traditional Chinese medicine are able to do the significant promotion? So this is where a lot of research to prove. A simple to talking about is herbal treatment enough can be promote the endometrial receptivity of the uterine, can be enhance the oocyte quality, and to increase the very research function, can be regulate protection, express, and the follicle fluid. Also can be rising fertilizing rate and promote the early embryonic development. And also we can control overall hyperstimulation because a lot of doctor is hesitate to give the lady with the PCO to do the IVF because they warrant that patients, the ovary is so sensitive, they easily to happen the hyperstimulation condition, making very dangerous condition. So this is where we can using TCM promotion, making the patients is a balance and the general well-being well. So this is where can making them easily to acceptable, successful with IVF. So this is where we also have successful case to how TCM preparation to doing IUI. That means someone with a very bad condition in the past, be preparation with the TCM well. When they see the doctor in the fertility clinic, can like doctor to notice patients to behave to the real good condition. So this is what they can do is a simple ART, IUI is enough. And also some couple with both with the problem, the lady with PCO and the man with sperm problem, then we can give a preparation to making the lady's PCO be good controlled. Then doctor can be do only ICSI to give the sperm selection, making they successful. And also for fertilize the egg, also patients can be fail 1 or 3 or more times IVF. But after TCM preparation with the fresh embryo, also patients can be successful easily. So this is where we said all of alternative treatment, the main shortcoming is treating powerful weaker. So this is where patients can be feeling better, but actually doctors don't feeling satisfactory. So this is where we said, as TCM practitioner, the key point of us is just should be making managing for technology well in our profession to making patients have good enough the treating result. Then we can making patients' general well-being is rising up to give the doctor good support. So this is where we said, how do we managing our technical professional well? We said, first time, we should know which time to do TCM is best. So this is where, before the research, and always most of the fertility clinic try acupuncture, always try using acupuncture in the one before the egg to pick up, and another one is fertilized egg to feed in. Some clinic can be do only last time. So this is where some research to prove this acupuncture doesn't work, because I believe not means acupuncture does work, if it hasn't done them in the right condition. So this is why we say, what time TCM be involved to the IVF treatment? We always said, if anybody have the gynecology disease or they failed with many times fertility treatment, they always have some off balance condition, have some health or diseases condition, it couldn't making them successful. So this is why we said TCM should be involved before they do IVF. So in generally, we should be offer patients 3 months before IVF. So this is where special someone, if they fail with many times IVF, we need using the herb or using acupuncture to building general well-being, making the healing for the off-balance condition, making general condition and the hormonal levels go up. So this is where we believe anyone, according to your health condition and the gynecologian special condition, then decide the how long to start the TCM treatment. So my treatment can be someone with premature ovary fail. They have to start the TCM for 1 month, 1 year to making regularly menstrual cycles. Then we refer them to IVF. They can successful much easier. So what kind of the TCM module? We said, how making the TCM treatment is good enough. So this is where we believe the best way is making acupuncture and the herbal medicine mixture. And if patients like, can be taking nutrition and another kind of the psychology balance treatment together. So the acupuncture, we have the promotion acupuncture technology modules. So this is why we said 30 needles approach to prepared conceive or prepared IVF. These 30 needles involved someone in the tummy. We said this tummy 4 point is the main point, can be combined with TCM and anatomy series, such as we run vessel 6 and number 4, they just close to the uterine, and 子宫 or stomach 28, 29, they close to the ovary. So prepared for the IVF, we give the uterine or give the ovary is enough stimulation, making the whole relative organs good preparation. And also from the research, acupuncture can be stimulate the patient's self-healing system. So this is where do the acupuncture also can let the patients is a good correspondence with the preparation drug before IVF. And also the acupuncture can be stimulate overall, making the patient's ovulation happen on time. For someone is couldn't happen ovulation on time. We said, where do we have to use in the herbal medicine? Recently, we have particularly herbal medicine treating module. It's a follow menstrual cycles using managing the herbal medicine. We can using herbal medicine to promote the hormone levels any stage, such as we give things the menstrual cycle, we classify them for the 4 stage. For the first week, we can prepare kidney and the spleen to promote the follicles growing up and growing up strong and quickly. The second week, we plus the herb for the moving liver tree. They can promote the follicle matured and ejaculate. The third week, we can manage the herb slightly changing, making them warmer. It look like progesterone taste. So this is where they also can be promote the ovule is settled down easily and grown up normally. The third week, making the promote the progesterone happen the good significant work. So this is where if we can manage the herbal medicine follow menstrual cycles, then we can make patients the menstrual cycles in the good condition in each period of time. So this is where we are able to preparation. In January, the TCM can do help for preparation. Also, we can do the treatment for during IVF. During IVF in January, we don't using the herbals and using only for acupuncture because nobody do enough research to identify if herbal medicine to disturb the drug medication. So this is why we always using acupuncture during the treatment. And after IVF, when the ovule fertilize and plant in the uterine, we notice the baby finally birth rate is much lower than biopregnancy rate. This is where special IVF, special the pregnancy successful through the IVF. So this is where we can using the herb. We herb can do someone for protective ovule decoction. That is for the lady, they has a few times fail of the miscarriage. So this is why we can prevention to using the herb, making them successful. And another one is preventing miscarriage decoction. That formula is for the lady is abdomen pain or the bleeding is show out in the clinic. So this is where the potential miscarriage happen. So this is why we're using that herb can be quickly to support the lady and support the baby. And also someone to show the babies couldn't grow up, they're too small compared with the months they should be. We also able using herbals to promote. So by now, I gave the few successful case to report here. The case one is a 29-year young receptionist. During taking the contraceptive pills about more than 10 years. So this is where since her stopped taking contraceptive pills, the ovary is still very weak. She no appearing for 3 months. So this will come to TCM for preparation. When after our the treatment, her period coming back. So this is why she getting the fertility clinic after 3 months quarantine. But doctor noticed she has regularly appearing and general survival condition. This is why she be cancelled the IVF, do IUI only, and success. So the successful case is a lady with the polycystic ovary syndrome. When she have the fail of one IVF, she have the only 2 times period during a year when she comes to see me. So this is why we gave the herb medicine, treat her polycystic ovary and the preparation. And then also when they found the husband also sperm disorder. So this is why when she getting the appointment to see the doctor, because the lady is recovering her proper period. So this is where doctor can be do only ICSI to selection the good sperm, then they successful to with the health baby boy. The third case is a quickly success from the ongoing IVF after TCM preparation, because this lady is 36 years old, but when she see the fertility clinic, she be found FSH 33 and AMH only 1.7. So this is where doctor said she is show premature ovary insufficiency. So this is where doctor offer, if you want to do the IVF, you have to donate it. So this is where, you know, some lady couldn't acceptable someone else donated egg. So this is why she come to see me. After I gave her preparation, then she went back fertility clinic. Always hormone levels is going back to satisfactory. Doctor in fertility clinic also is very pleased for her condition. This is why she be using her own egg to do IVF with successful have the little girl. The number 4 case is one doctor, consultant gynecology is referred that to me. They also, the couple lady with the irregularly menstrual cycles, and the boy also be found the antibody in the sperm. So this is where we have good treated, making them success. For this case, is a lady is 49 years old teaching. When she was young, she be have the miscarriage. So this is where the both tube both the fallopian tubes be blocked. So this is where she couldn't natural success. When she went to the fertility clinic, also be shown the hormone levels is too low. They said your premenopause is couldn't acceptable her. This is where she come to see me. After the TCM preparation, she making her regularly menstrual cycles. This is where the doctor acceptable her with a successful baby girl. I have recently a lady is 53, also premenopause, be preparation by me. So this you are going to the IVF again. So this lady is also the both fallopian tubes block and couldn't success with the natural pregnancy. But she also 3 times failed of the IVF treatment. So this is why when she come to see me, you can see the diagnosis is a fallopian tubes block and antibody with the husband as well, because these patients with inflammation for long times history. So always happen antibody probably related caused by inflammation. So this is where is making the double difficult to have the natural pregnancy, and also not very easy to do IVF. After our preparation, the lady went back to the fertility clinic. The doctor found the 3 is a good fertilized egg. Probably it's a few times fail. They complained to the doctor. So this is where doctor in the fertility clinic put the 3 embryo in her uterine. But because she had so good condition, so this is where the 3 fertilized egg whole success. This is where in the 4th term, she began the cesarean, have the 3 healthy children, 2 girls and 1 boy. And some lady else, if she also is premature, ovary fail, is be refused by the doctor to do fertility treatment. So this is where after we success to support, doctor acceptable her is do IVF, but she have twins be bio pregnancy. But when she worried about herb protection, so this is where miscarriage lost 1 girl. This is where we gave them continue to support by the herb birth. She hold on for another girl. Then after 2 years, doctor fridged the eggs be put in again. So this is where she also to show the early miscarriage. Then we gave them support, making the ovule strong and the lady is healthy. Then under the term, she has a little twins. So this is where we're making the successful rate to give the doctor fertility clinic is good support, making you higher successful rate. And also some lady during the treatment prepared for fertility treatment, but they just natural pregnancy. So this is where you can say we can making the lady natural pregnancy also can be give the doctor is stronger support. We said if we combine it together hand by hand, we shall be making much more ladies, much more happier, much more couples have the happier family. Thank you ever so much.